My name is Dr. Andrew Ferber. I'm 84 years old. I've been practicing psychiatry for 60 years. I've been a meditator and a yogi for 50 years. I've seen a huge amount of PTSD. I've worked in 3 Veterans Administration hospitals in Iowa, Pennsylvania. I've probably worked with every age from birth to death, rural and urban. So I've seen all the traumatized people in our society, the battered women, the people after auto accidents, the survivors of professional athletics. I've worked in pain management too. And I know things about PTSD. Vietnam vets would say to me, "You're the first guy since Nam I can talk about this shit," because it resonated in me and brought to mind my own PTSD. This video is about a amazing discovery that Doug and SammyJo Wilkinson made quite recently, that TED's pain cream, if applied to particular places, releases traumatic memories relatively painlessly and forever within a time frame that sounds like between a week and at most a month, which is incredible. So I would like them to tell their stories first of their experience with this.
In November 2017, a biological physicist friend of ours came over bringing a tube of TED's cream, and he was telling us how it had helped him. So I have suffered from cervicogenic migraines most of my adolescent and adult life. And he actually gave me a tube of TED's cream, which looks something like this. Came in a nice little box, TED's cream. And he said I should apply it to my neck and the area that had inflammation. So my headaches, they were just about every day of my life, and from severe degree to mild degree. So what I did was I took out the TED's cream and I put it on my trigeminal, my greater auricula, and down to my vagus nerve. And within 5 minutes, my headache cleared, which was just phenomenal, just amazing. And then every time it reoccurred, which was usually a few times a day, I reapplied and it would go away. I did this for several months. And well, actually, I only did it for 2 months. And then, but each time the daily dose diminished to the point where I rarely use TED's cream currently. I had maybe 4 to 6 headaches in 2018. And in 2019, this year, I've had maybe 4 to 6 headaches. But they go away in 5 minutes. So my lifelong suffering with headaches, which really diminished my life experience in all sorts of aspects, went away. One of the little odd side effects that happened is when the headaches went away, I started misstepping. And so I had to go up and down the stairs, 30, 40 times to get my feet back in order, because it's different walking, and I didn't know this, but it's different walking when you have pain versus when you don't have pain. Okay. So the next thing that happened is I have post-traumatic stress disorder, which was diagnosed by Dr. Ferber. And so I was working with that using different approaches. And then one day my wife told me, "Why don't you put TED's cream on your vagus nerve," which, as the vagus nerve runs through the whole body. And so I had disturbances because I've always felt like clutch, because never knowing when the next attack was going to come, right? Because I grew up in a pretty abusive household. And that carried with me through life, and those early wounds never left my nervous system. And so that was like really diminished my life too. So I put some TED's cream on, and within 5 minutes, those nerves relaxed. And I could actually feel the trauma had left, the nerves settled down, because those nerves were running hot for 40, 50 plus years. And now they settled down, and it's like I have a whole new start in my life. Occasionally, they have come back. I had an incident with a plumber trying to fiercely overcharge me, and I took that badly, and that trauma came back, but I put the TED cream on. 5 minutes later, it's gone. And I used the TED cream right below my belly button where those nerves cluster, and it just relaxed. And it's like, my God, I got past trauma. I've been meditating since I've been in my early teens to try to help with this trauma. And I tried medications for the headaches, everything. Everything seemed to work, but only temporary solution. And yes, I got some relief from the AMA drugs that I used, but the only really relief I got was permanent relief, and I consider this permanent at this point, even though, I may have an exacerbation every couple times a year, but I put the TEDs on and it goes away within just a few minutes. So that's pretty much my story with how I believe I have overcome my headaches completely. And I've also overcome my post-traumatic stress disorder. And my life, which was always kind of stressful and always on edge, I had symptoms like hypervigilance and trusting issues. And all that seems to have relaxed. And I feel normal for me was always being stressed. And so now I have a new normal, which is being relaxed. So that's my experience with TED Screen. And I use this roll-on too, this one, because I have gout-related issues and I didn't want to use the salicylic acid that was in the gel, in the cream too. And this works just as well. Actually, truthfully, this is a better applicator because it has this roll-on tube. So it's a much better applicator and I can cover my body really easily. So what I have been doing is been covering my whole vagus nerve right on down through my throat, through my chest, right into my abdomen. And that seems to work. I have other pain issues sometimes in my knees, and that helps that too. But the most profound uses or relief I receive from TED Scream is no more cervicogenic headaches and no more post-traumatic stress disorder tension in my body.
What has your experience been with it?
I didn't have so much like a post-traumatic stress. It's more like chronic traumatic stress when you have a chronic illness, like I've had MS for 25 years. So it's just sort of taken the edge off, and it makes it a lot easier to fall asleep, meditate, stay calm. And I'm actually, one of the things you learn with MS is that stress is like an instant trigger of your symptoms, and they will just come raging on if you let stress creep in. So I've developed, a lot of mental control over it. But now it's nice to have this little cream as the extra support for that, and it makes it much easier. That's been my experience with it so far.
And I've seen a huge amount of PTSD between 3 VA hospitals and working as a psychiatrist for 60 years. And I have my own PTSD since 1970. I'm not going to go into all the details yet, but when these guys told me about this amazing possibility, it came to me in meditation to apply it in 11 places simultaneously. The crown of the head, governing vessel 20 in Chinese medicine, where the 3 sutures come together. The third eye, someplace in the brow. Run the line from the nose up to the hairline just to be sure, because it's different in each people. The throat chakra, radiation. You get to the thyroid cartilage where the Adam's apple is, and the cartilage is below that. You rub it all over that. Both sides, the vagal ganglia, under the ear, in front of the bone back there, and behind the jaw. And you rub it in there, and then all the way over to the thyroid cartilage. Same on the other side. Then in the palms of both hands, here you want to get in this point here between the thenar and hypothenar eminences, right in the groove, and bring it up just like that on both sides. Then the solar plexus, which is in me about 4 fingers above the belly button, 3 fingers below the xiphoid, right about here, and the hara, about 5 fingers below the belly button. And last but not least, the bottoms of both feet. Again, between here down to here like that. So that's 11 points. Within a couple of days of doing this, and I would only do it like twice a day, I noticed that in my meditations, my trauma memories would come up in no particular order, I might add. Not like a movie, but almost like balloons floating in the air and out of sequence. The ones from my main trauma, which was a rather abstract one, I freaked out over the state of the planet after reading Limits to Growth, went in terms of concepts just going away. And then after a week or two of that, I've been applying it usually twice a day. The best is to do it after a shower or bathing, and then to either lie down passively or having someone massage you so that you can just watch what comes up. What came up today, for instance, I had a massage with my wife. I put the TED's pain cream on just before it. And first it came up a memory from when I was 7, and my mother stabbed me in the butt with a big Frankfurter fork. And I ran away saying, "You demon, I'm never coming back." I came back in 2 hours. But what I realized was that the big trauma is, which this memory symbolizes, is the realization that you can't count on your mother to always give you the love you feel you need. And that's for everybody. That's the second big trauma. The third big trauma that came up shortly thereafter was there was this memory of, I was in Estes Park, Colorado. I was 8 years old. My father was in the Army, and he was taking me for a walk in the wintry woods. And I'm climbing a rock wall with ledges only maybe, 2 to 4 inches. And I get about 20 feet up, and I realize I'm in a panic. I'm about 5 feet from the top. My father's up there saying, "Come on, Andy. And if I fall down, I'm going to die." And what this trauma is about is the condensation of, I can't trust my father to figure out what I should and shouldn't do. I have to be on my own, basically, from here on out. Now, these are traumas that everybody has. Each one of us will have our own symbolic representation of us when you get to that level. And even, I said that's the second and third most important traumas. The most important trauma that came up about a week ago was a remembrance of the birth trauma. Because when that happens, you're cast out of paradise. And it's not a concept about it. It's something deep in the tissues that knows I'm either on my own or I'm dead, man. The infant doesn't put it in those words, but that's the birth trauma. The other thing that I've come to realize with the TED's pain cream is that there's, in all trauma, a positive side which contemporary theories disregard, because they're basically materialist theories, as though the brain and the emanation, thoughts are an emanation of and the mind is an emanation of this big machine. Or they're old-fashioned traditional religious theories which posit a separate soul and body. And all the theories of PTSD are built on this. There's a third force in all life that the great mystics have called life or love or consciousness. And the PTSD, the trauma, always starts in a person a profound opening to more of this energy that is seeking union with the divine. We won't go into arguments about what the divine is, because different people have different dreams about it, but there's a much more widespread agreement that there's something out there or in here that we're seeking to become one with. In Christianity, they say God is within you and without you. In Buddhism, they say from the very beginning, all beings are Buddhas. In yoga, they say yoga is the cessation of the ripples of the mind. However you cut it, there's this energy that is stimulated by PTSD that drives one towards transcending it. What prevents you from transcending it are these hardwired memories in the nervous system. All the so-called therapies, they chip away at it. They bring it up, or they tap on things with EMDR, or they do play acting or yoga. It all helps a little bit. But this stuff, just in some way that I don't know what the psychophysiology of it is, I leave that to generations of researchers, because whatever your frame of reference, you're going to find an explanation. The thing itself is much more mysterious than any explanation. My favorite way of conceptualizing it is that each memory is an active process that you are doing, which saps otherwise available free energy and blocks a flow of energy by keeping you in what's called the past. When you let the memory go, the energy that was creating the block becomes available, and the block is no longer there, so there's even more energy. So more effortlessly, I'm experiencing the mysterious happening called life. And I think that's a good introduction. I can't stop thinking about this stuff, and I want to try it for as many people as possible and see whether the three of us are dreaming or whether we opened a window to something really fantastic. But my deepest insight is that mind itself can be conceived of as because of trauma. You have to learn to witness, to watch what it releases, because if not, you're in danger of either becoming a chronic patient or making a melodrama out of your memories and still living in the past by choice rather than unconsciously. So the stuff that comes up, you have to remember there's a movie in real time called Me, in which I imagine I'm the director, the producer, and the actors. If you can only remember that you're the audience and not the movie, that is the essence of meditation, and that will allow you to let these memories disappear as they come up. Thank you for your attention. I hope you do this for your benefit and the benefit of all mankind.